Kia ora koutou, welcome along to our briefing today. We're in and out of some public and public excluded moments right through the rest of the day. In the first part of today's Friends of Ellesmere Hospital, we've got Phil is running 15 late, Megan is online, Malcolm's got vertigo and won't be coming to join us today, and Deborah's an apology as well, so I think that accounts for everyone either is or will be or won't be here. Nicole is in the room, is in the building, and we'll be back into the meeting soon. So to start off, we've got the Friends of Ellesmere Hospital. Jeff and Murray, thank you for coming in and presenting some work to us. I guess the background to this was it was part of the Three Waters work and funding that the government gave us last term. There were a number of different projects that we assigned that money to, and this is one of them. Next week we've got a presentation on the cycle trail coming back. That was another one of the projects, and there were a couple of others. So yeah, there's been a long process through this, but really great to have the understanding of what we might or might not be able to achieve, and we've worked with the Friends of Ellesmere Hospital on it. So Jeff and Murray, thank you for the work that you've done in the community and bringing people together and expertise to try and understand feasibility of health needs and delivery in our local area. I'll hand the floor over to you, Murray. Welcome back. We're just saying it's been 2 years since you've vacated Shane's seat, was it? Sitting there, yeah. And the microphones still work the same though, so if you just press the right hand button, that'll turn it on. Thank you.
Morena, thanks Sam and councillors and staff for the opportunity to present today. It was a good summation, Sam. What we hope to do in the public side of this is to just give you a brief rundown of the history of the hospital, the history of the Friends, and perhaps how we arrived at this feasibility. You've touched on that already. And then once we go into PX, Jeff Lill, who's our treasurer, but also more importantly has been actively involved for much longer than me. I'm only a newbie here around the Friends table for about 2 years. The difficulty is that you leave one role and go into another, and all of a sudden they vote you in as president. I'm not quite sure how that happens, but very, very good. Look, the history of the hospital, Sam and Grant attended our 100th anniversary in October. October the 1st was when it opened. So it's a considerably old building in a beautiful setting. At the time in the 20s, the community saw a need for a hospital there, and there was debate about whether that was a general hospital or a maternity hospital. They decided on maternity, and I think that was probably a wise move because literally came into that boom post-World War I and then again post-World War II, obviously. So basically, if you're of a certain age and were born in Ellesmere, you were born there, or you gave birth there as well. So there's a strong community history there going back. It relies heavily on the support of the local medical centre and the local doctors, and that goes right back to its early formation and continues to today. We go into more recent history, and in the late 80s there was talk of closure of the hospital, probably reforms a little similar to what we're seeing today. And from that, a focus group in the community formed, and that eventually became the Friends of Ellesmere Hospital. So particularly Dr. Hobbs made submissions to Parliament, and they managed to keep the hospital running. It ceased to be a maternity hospital and became a more specialised hospital, which largely, and still does, caters for palliative care, respite care, and there was some rehab and bits and pieces happened in the past, and that may again occur. The role of the Friends largely is about fundraising and, I guess, in-kind support for staff and patients there as well. So we provide some of the things that wouldn't necessarily be provided by the DHB at the time. So Jeff joined, we'll say about 2018, Jeff. So around that time, it was becoming pretty self-evident data disrepair. So the Friends group made approach to the then DHB to see what the story was with that, and how, you know, there was a little bit of concern about what that meant. So the outcome of that was that Jeff was to go out and get quotes for repairs to the building, painting, etc., which was duly done. That was presented to the health board, and basically nothing happened. So that again raised alarm bells, and that was when the contact came from Jeff to us as councillors around the table. So Grant, myself, and I think initially Pat Grant would have been at the time. So there was some discussion around that. We decided that one of the models that had been successful in terms of amalgamating a range of health options at that stage was Zachariah. So mid-2020, a group of us went across, Jeff, myself, Grant and Douglas Marshall, and we met Pat over there, who was no longer a councillor but still had that connection as a ratepayer there as well as his previous involvement. So we went through the facility with Jenny Masters, I think, yes, who was the change manager, and that was an amalgamation of an old hospital, a doctor's practice, aged care, palliative care, and various things. And we looked at that model, and it seemed to fit a wee bit of what might work in Ellesmere. So we decided to extrapolate out a wee bit more what that meant. It also gave an opportunity for the Friends to have a discussion, and they agreed to put $7,000 towards an initial scope of feasibility for how that would do, and that was duly done and came back, and we looked at that. And both Grant and I at that stage were part of the investment portfolio, and it seemed to look as though it may tick the boxes as to something, you know, with being as the council is the owner of the building that the GP is currently in. It seemed to perhaps tick some of those boxes, and we felt there needed to be further work around that. The difficulty, of course, was funding it, and as Sam's alluded to, the goose that laid the golden egg came out of the woodwork, and that was the ability to put that towards the Better Off funding at Round Council, which was duly done. And I think, I'm just struggling to remember now whether I moved it and Malcolm seconded or vice versa. I think it might have been Malcolm that moved it. So that began a process whereby, in conjunction with council staff, we were for want of a better term, the owners of that feasibility, but heavily involved with council staff, particularly Denise and Kelvin and Murray Washington, I think, were the key staff behind that initially. Innovo were engaged in that and did an initial draft feasibility. That came back and seemed to support the idea that we needed to go further with that and get a better look at what the actual costings would come back to, and Jeff will speak to that in the PX side. Obviously there's some commercial sensitivities there. That then went through the next stage where there was some more in-depth engagement with the key person, you know, the key players in the field, and that came back, I think, January, February this year. So we've had a period of time where we've had to sit on this. We needed to await the outcome. We'll speak to this again in PX, but the outcome of the Whātaro project for council has a bearing on siting and outcomes. So we had to await that outcome. There's also, Jeff and I have been heavily involved in conversations with Whātaro as well, and they're now, Jeff tells me, in their third iteration of going through whether they've got jobs. It's been extremely disruptive for them, and for them to give indications of what may or may not happen has been particularly difficult for them. We've also been very lucky to meet, and we're going to meet again with Nicola Grigg. We've met with Nicola previously, and through that, Nicola arranged for me to have a meeting with Minister Retty as well, and it's fair to say that was quite productive to get an understanding of what central government's view is on health delivery. It will still be the outcome of Dr. Levy's review, but it's fair to say that he's impressed with the fact that we've been disengaged with community and been able to carry something forward. So we're heartened by that. So the next step in the process, I guess, is to present properly in PX, as I say, commercial sensitivities to councillors, the findings of that, and have a discussion. So I don't know if there's any questions at this stage. It's probably best left to that PX because most of it I imagine will be around the commercial side of it, Sam. But if there's anything else you want to know about Friends Group or the process.
Is there anything about the background that people would be interested in asking now? We've got a few new faces around council since this project first started, so happy to, if there is anyone.
Just purely acknowledgement, really. I wanted to acknowledge apa te hono tata hono, te hunga mate, haere atura, he haere atura, kei te mihi, tēnei te mihi, te kōrua, tēnā koutou mā, ki te mahi, i ngā hapuri, ngā wai kirikiri. I just wanted to acknowledge those here, those that have passed on, that have been part of the volunteer hours, hundreds of thousands of volunteer hours, time, sweat, blood, tears and money, gone into keeping a facility like this as part of the community. I appreciate all of the work that's been done in here, but also the council in enabling the feasibility study, and I'm happy with the application of the funding that's been put forward, and look forward to hearing the nuts and bolts. So thank you.
Yeah, Kapai, Shane. I said at the 100th that we stand on the shoulders of giants, and we certainly do. We're just the last in the line of volunteers, as you've acknowledged, and certainly there's been some sterling work in that past 100 years to get us to the point where we are now. So thanks, Shane. Appreciate it.
Thank you. Elizabeth.
Yeah, thank you. It's a long-awaited report today, so I'm very excited that it's come to the table. I do have a question. It's probably been asked in the past, but just as a refresher, how many people on average does the hospital support and the hospital beds at your current facility, and how long on average are people usually there?
I don't have the stats for how long they're there, Elizabeth, but it's a 10-bed facility, and it's fully staffed. It's got 24 part-time staff, so and locals as well. So from that perspective, it varies in occupancy from probably 30% up to about 80, sometimes 90%. In other words, anything from 3 patients up to 9. I guess at some stage it's had 10 in it. One of the biggest frustrations we have is that we're a wee bit unique in the health sector at the moment in that we've got no pressure on staffing and capacity, and it's trying to get. That was one of the things I said to Minister Reti, is that you could relieve pressure on your main hospitals by actually utilising the staff you've got there. And it was very interesting during COVID. The facility was shut down for safety reasons for a period of time, and those staff chose not to be redeployed. They saw their role as being purely, they stayed in health delivery because it was local and because they were local. And I think that's perhaps not unique around New Zealand, but it certainly is something that we take a great deal of pride in. Jeff.
I think too, just very recently, Linda's team has gone through a retraining for a particular type of, and I should have done my homework on this before, Elizabeth, but they are actually, their bed numbers, their beds are fuller now, probably more just in the last month or 6 weeks than they have been for some time. And I can't remember what the retraining was in, but it was basically the idea being that they would relieve pressure off the likes of the public system by bringing patients out to Ellesmere. So.
Okay.